When the pandemic first developed, we saw a rush to find enough masks and protective gear. Medical workers and first responders were a top priority because they have to wear them each day on the front lines. And while the supply shortage has started to ease, it's still difficult to find some items. But now a new effort by a major insurance company, along with researchers and manufacturers, will solve the problem. And it's a solution that is made in North Carolina. Every day, healthcare workers on the front lines of the pandemic depend on a micro-thin barrier of protective gear. Gowns, face shields, masks, and when the supply started to run short, Blue Cross Blue Shield and others took notice.
Well, we are the only major payer that's based in North Carolina, and so we think of ourselves as part of the fabric of the state and part of the healthcare system. And when North Carolina providers are in trouble, and we're living through an emergency, both at the state level and nationally, we will do everything that we can to help keep North Carolinians healthy.
That's the idea behind the Made in North Carolina collaboration, which will produce up to 200,000 N95 masks a month. As the machinery started to arrive, they turned to NC State's Nonwovens Institute to develop not only a cost-effective fabric, but one more part of this complex manufacturing process.
We know how to build these things, but we've never built one. And I contacted the companies we work with, and they wanted a lot of money for them, and it would take 6 months. We went from a blueprint to a final product in 2 weeks.
That's the kind of lightning response healthcare workers needed. NC State researchers, the seed money from Blue Cross NC, along with Freudenberg Performance Materials, UNC Health, NC Healthcare Strategic Partners, the NC Medical Society, all combined into an effort to make a difference.
People got motivated. One of our labs is running 2 shifts around the clock. We're doing 24/5 right now. And the other lab, our staff have been working tirelessly. They never went home. We've been here 12 hours a day since the beginning of March.
We never imagined, say, a year ago that we would be in the business of trying to produce masks and get them to providers. But when your neighbor's house is on fire, you carry a bucket.
The Made in North Carolina initiative will eventually turn out 2 million masks a year. The goal is to bring the price down, get them to doctors and nurses in our state at cost. While other parts of the country, healthcare providers are paying 5 times as much as they were before COVID. It really shows the technical expertise found here in North Carolina. I don't know any other state that could have turned this around that quickly.
There is no other place on earth that actually has a program in nonwoven technology. So we are the only ones that actually have that. We are the only nonwovens institute in the world. And we are the largest research institute in North America in a university in all disciplines.
No more delays waiting on shipments of protective gear that could be weeks or months away. This is a solution that was designed and developed close to home.
We all can make healthcare better. So if we can do this to produce masks, we can do it to make healthcare more affordable. We can work together to improve the quality of healthcare.
The pandemic isn't over. Frontline workers still face challenges every day, but they know they've got an army of colleagues behind them working to keep them safe. The Made in North Carolina initiative will not only ensure there's a steady supply of masks, it'll also keep providers from facing price spikes that can mean much higher costs.